Are you,
Hi, Tom. This is Brian Goodman.
Hey, Brian, how are you?
Can you hear me?
Yep.
would you be comfortable if I did not have a mask on for this part if we're in here? Do you want me to keep it on?
No, it's fine.
Okay.
Yeah, whatever you want to do. Well, let's strike an apartment building on the west side.
It's crazy.
You working at the UW?
I've been off since Thursday, and then I start this Thursday, Friday, Saturday, Sunday, Monday. So
Oh, okay.
had a little bit of a stretch off, but it's nice to see that we're getting text messages again. I
Yeah.
don't know,
Yeah, I got one this morning.
so it's awesome.
Yeah, Sheila told me to go ahead and put some more hours in. This is my busiest time of year, so
I know, so
you know.
do what you can.
Yeah.
Okay, guys, it's about 3:02, so we'll wait 1 or 2 more minutes, and then we'll get started with today's Zoom.
See, I can never go into Zoom. But always not have the Zoom app.
So I just copied this meeting ID and go to Zoom here. We should be able to click join and paste the meeting ID. 5, ready. Might have to turn off your audio so we don't cause feedback, but sweet.
This is turned off.
You can turn your volume all the way down too. It is really slow. Okay, everyone, I think we'll get started here. Yeah, I think, yeah. Okay. So welcome. I'm here with Tom. We're in Oregon, Wisconsin with Oregon Area Fire and EMS. We are going to be going through some first aid stuff today. So for anyone who is involved in scouting, this is an almost exact replica of what are in the U.S. Scouts, both Boy Scout and Girl Scout merit badges for first aid. So you guys will be able to get some really good information. So I'm going to start with our presentation. So give me just a moment to get it lined up here. Okay. So, oh boy. Here we are. Oops, we're not even on the right page. Sorry, everyone. It's a sneak peek of what's happening ahead. Okay, so first aid for ready campers. So again, my name is John Collins. I'm advanced EMT working in Jefferson, Wisconsin, and also with the University of Wisconsin Hospital and Clinics in the Level 1 Trauma Center for both adult and children. And Tom works there as well. Tom is advanced EMT with Oregon Fire and EMS. He's a captain there. So it's really awesome to have. He has a ton of experience and a ton of really, really awesome things that he's done. So it looks like Lexian's just joining now, so we'll wait a moment just to make sure everyone gets included here. Awesome. All right, so up next, we are going to talk just real briefly about calling 911. Can you guys see the screen okay? I just want to make sure. Give me something in the comments. Can you see the screen okay, everyone?
See.
Yes, I can hear.
Okay, awesome. So calling 911. We just have a couple of things. Has anyone ever called 911 before? Yeah, it can kind of be a scary thing in some ways.
Yes.
Yeah, exactly. Can you guys see on my screen like the participant names in the chat, or is it just the PowerPoint?
Just the PowerPoint.
Okay, perfect. So yeah, calling 911. So it's pretty easy to do, just 3 numbers, and you can do it from a cell phone or from a landline, anything like that. And in some areas, you can even text 911, so that's pretty cool. Tom and I can kind of talk about the way it works here in Dane County, but if you call 911 on your cell phone, it routes it to the nearest public service answering point. So it's a PSAP or a 911 call center. So at least here in Dane County, the way that it works is you'll talk to what they call a call taker. So that's someone who answers the phone call and starts getting information. Usually the first thing they'll ask is, what is the location of your emergency? So that way, if you disconnect or if you have to hang up or something, they at least know where to send someone to figure out what's going on. The next thing they'll do is they'll try and figure out what kind of stuff you need. So do you need a fire truck? Do you need an ambulance? Do you need police officers? And once that happens, they'll start sending that over to the dispatcher who's in charge of that area. So there's, in Dane County, Wisconsin, there's a dispatcher who's in charge of the fire and EMS. There's a couple that are in charge of the City of Madison Police Department. There's a couple that are in charge of the county sheriff's office and some of those other things. So if you need a fire truck or an ambulance, they'll shoot it over to the dispatcher who's in charge of the fire and EMS and start getting more information that way. Here in Dane County, they have a really, really scripted way of asking questions. It's really protocolized. So if someone says, I have chest pain, it pops up and populates a list of questions that they'll ask. So like, has this ever happened before? What does it feel like? Is the patient breathing? Some of those sorts of things. And then depending on the answers, they might say, okay, what we'd like you to do is go get some baby aspirin and give it to the patient, or they may give you other instructions. Like if someone's bleeding, they might say, okay, we want you to apply pressure to where the bleeding is coming from, or some of those other instructions. So those are really, really valuable if you're able to do that. Even if people are, maybe someone's not breathing or who's unresponsive, they can give instructions about how to do CPR over the phone, which I think is pretty cool. One of the biggest things that is helpful for us is, and I've experienced this, I don't know if Tom has, but if we are like going to a mall or a school or something like that, it can be really hard to know where we're headed. So if you're like at the mall or something like that and you're calling 911, if you can say, hey, you go out to the street and meet the ambulance and bring him here to the patient. Because if you can think about a mall that you've been to, trying to figure out which door to go in and where to go after that, that could be really hard in an emergency. So that's something that I think about as well. Do you have anything else for calling 911?
Yeah, with calling 911, they do ask a lot of questions. And what they're doing is they're basically collecting information. They're giving it to the firefighters or first responders, whoever need it. So it seems like they're asking you a ton of questions and they're not doing anything. But like John said, that as soon as they find out the location and find out what the emergency is, they've already sent the information to the ambulance or the fire or the police. Now what they're going to do is just ask you a lot more questions to try to find out what's going on. Because as an emergency responder, all the information that we get from the comm center or from the 911 caller, that's going to help us prepare for what we're going into. I mean, I got paged out to someone that was feeling sick. And when we got there, grandma was actually dead. And it was just because grandpa just kept saying, oh, grandma's sick. She doesn't feel well. She's sick. But, you know, grandma had went unresponsive on in the hallway. And when we got there, she was dead. So big difference between being sick and dead. So they're trying to ask questions to help our job or make our job go a little bit quicker.
Yeah, that's perfect. Because the more information, the better. You know, sometimes we'll go out on an ambulance call and like they said, it's like an unknown problem or someone's sick or someone in the background's just yelling, we need an ambulance. But if we're able to find out, oh, this person has a broken leg, well, we can get more supplies ready. We could maybe get some medications ready. We can get some of our splints and things like that we'll talk about later. So it can be really helpful to give us more information, the better. But something that both Tom and I have learned is that sometimes the information isn't always accurate. So every once in a while, someone will call and say, hey, we have, you know, my sister's feeling sick, and we'll get there and it's 5 guys who have fallen off of a tractor or something like that. So it's totally different from what we're actually being there for. But that's part of our job, is being ready for anything. So, okay. Up next, we have just a little bit of anatomy and stuff for you guys. So this is a picture of the human respiratory system. And we tell you this, we're not going to really test you and say, oh, where is the oxygen exchange taking place? We want you to have an idea of what happens. So that way, if there's an emergency, maybe you guys can critically think about it and think about ways that you could help a patient. So if you look at the screen, excuse me, you can see the picture of the human. So as I'm sure we all know, the air's coming in through the nose or the mouth, coming down the trachea into the lungs, and that's where the air exchange is taking place. And so the oxygen's coming in, it's getting into our blood and flowing through the body. And then once our body has used the oxygen, the cells give off carbon dioxide, and that goes back to the lungs and out through the mouth. So we're taking in different gases, we're sending out different gases. So that's just what, you know, every human being and every mammal does. So typically the normal number of times that people breathe per minute is about 10 to 18. So that's a question that a dispatcher might ask. They might say, okay, how many times is this patient breathing? And so they have a stopwatch, so you can say, okay, they're taking a breath right now, and now. And they can automatically calculate for you, so you don't have to try and think about using your watch or anything else. But if someone's only breathing 2 times a minute, that gives us more information, and maybe we need to try and get there a little bit faster. Or if they're breathing 100 times a minute, that could be really bad too. So that's just some of the information that really helps us do our jobs. Do you have anything else for this slide? Okay. And if you guys have questions, throw them in the chat. We'll be able to hopefully answer them for you. Okay, now this is circulation, and we'll all come back to this in a second. But once the oxygen enters our body through the lungs, it goes to the heart in the blood. And so the heart, the job of the heart is to pump blood through the entire body. So it's a muscle that's always going from before you're even born till the second you die. Your heart is always pumping. And usually it's about 60 to 100 times per minute. So that's normal. There are different times, like really young, healthy people can sometimes have a lower heart rate, or sometimes there's reasons where people have a higher heart rate and that can be normal. So everyone has something that's different for them, but your heart is always pumping blood, and it's getting that oxygen to your body and taking the carbon dioxide out. So again, we look at 60 to 100 as normal. We'll look at checking someone's pulse in a minute, but the way that this helps is that it's another question that the dispatchers might ask. So they'll ask about circulation. So remember, we talked about airway, breathing, and circulation. And now it all comes together. Oh, yeah, here, checking for a pulse. So can you guys see my video too, or is it just the slideshow?
Just a slideshow.
Okay, cool. All right, so this is a slide about checking for a pulse. So you can see these are 2 different areas that you can check for a pulse. So I want everyone right now to try and find their pulse. So on this video, we're going to show you, Tom's going to check my pulse right now.
So an easy way to find a pulse is if you put your thumb up, just slide right down the thumb. There's like there's 2 indents right here, and that's where the radial pulse is hiding. You don't want to apply a lot of pressure, just apply a little bit of pressure, and each time you feel that boom, that's the pulse. So again, just slide right down the thumb, right in between here, and that's where the pulse is hiding. You guys find it?
Nice.
Yeah.
Perfect.
Good.
So that's one way. Another way is the carotid pulse, and that one sometimes is a little bit easier to feel. And so if you just come straight down your neck, you should be able to feel it. It's going to be behind your windpipe, but in front of the side muscles of your neck. So you should be able to feel it, and it's easier if you're not talking. Yep, so you can feel the pulsations there? Yeah, that's perfect. All right, we're going to go back to the slideshow. Okay, so we are checking for a carotid pulse, we're checking for a radial pulse. Any of those are good options. Now, we're going to put this all together in, not yet. Here's a little bit about triage. So, triage is a French word. It comes from, the meaning of the French word is to sort or to organize. And so triage in EMS or in any medical setting is determining which patients are the sickest and which patients need the most help. So if you look at that little graphic on the left-hand side, at least of our screen, there's category 1. So that's like someone's having a heart attack or a really bad car accident. And so they may need help that's like in the next few seconds to save their lives. And then as we start moving over to the right side of the page, you'll see things that are maybe not as important. So category 5, when I see category 5, I think about someone who has a stuffy nose or who has maybe a little bit of an upset stomach or a splinter. So not that those aren't important, but we don't need to get to them as quickly, or they maybe don't need resources as fast as someone who's category 1. So the way that this helps us is maybe if we have a car crash and we have 5 patients, Tom and I can both go to the scene and figure out, okay, this person's category 1, they need help the fastest and they need the most help. So we can have one of our colleagues or another ambulance say, okay, you guys go to that patient right now. I'll take care of these 2 or 3 patients who maybe just need a Band-Aid or an ice pack or something like that. So that's kind of what triaging means. It's like sorting patients, especially if there's multiple patients, and figuring out how fast they need the resources. Okay. Up next, we have universal precautions. And it sounds like it's kind of a long word, but the point of this is you never know what could be happening in someone else's body. So if you saw 10 people lined up, it's possible that one or two of them could have an infectious disease and we wouldn't know about it. So examples of that could be hepatitis, it could be AIDS, it could be some of these other things. And those diseases can sometimes be transmitted in blood or saliva or vomit or some of those other body fluids. So the best way that we can fight that is if we just say, you know what, we're going to treat every single person's blood or body fluids or spit or anything like that as though it's infectious. So that helps protect us from getting a virus that we don't want. And it also keeps everyone else safe. So even if someone is totally healthy, they have no viruses, we may not need to have all these precautions. We do it just in case, so that way we're protecting ourselves, because it's not real good if you or someone who's helping a patient gets sick themselves, then they can't help anyone else. So what are some ways that we can enforce or use universal precautions? So you can see some of the pictures there. Washing our hands every time after we touch anything that could be potentially infectious, using a gown or an apron, using gloves, a mask, or eye protection goggles. Those are some of the things that we use. So like right now, a lot of us have masks that we wear on our ambulance calls. We wear gloves all the time, anytime we could be touching something infectious. Washing your hands is really, really important. It's so, so important, with soap and water for 15 seconds. So those are all ways that we can help keep us safe and help keep our loved ones safe too. Anything else to add?
Yeah,
on that one?
and of course with the COVID-19 going around, John and I are in close quarters. I have my mask on. You know, if we both took our masks off, then we wouldn't be following the guidelines that were set forth by the CDC. So we just want to make sure that, again, we don't want to become a patient. So we want to make sure that we use these simple precautions to protect ourselves.
Mm-hmm. Yeah, it's all really important. Okay, up next is a heart attack. All right, so you guys may have heard of a heart attack before. This is something that can be really, really life-threatening. And so if you guys can look on the screen, you can see those little red, they look like vines coming around the heart. And that is how the heart gets its oxygen and its nutrients. So blood comes right out of the heart as it's being pumped to the body, and there's a little tube that comes right out, and it just shoots some blood right back into the heart. So it's coming right out. Yep, these are called the coronary arteries. Perfect. So what a heart attack is it's a blockage of one of those arteries. So you can see in the little zoomed in picture, that's a blood clot or something that's preventing the oxygen and the oxygenated blood from getting to the heart tissue. So have you guys ever like accidentally like sat on your leg wrong or your arms gone to sleep or something like that? That usually is from a lack of blood flow. And so if you think about that, it takes maybe what, 10 or 15 minutes for your leg to fall asleep. The same thing is happening inside your heart. And so, except it's not going away. So it's getting worse and worse and worse. So sometimes people can have a little clot in their artery that can maybe not block the artery all the way, and some blood can get through. So it may be okay for a little while, or they maybe don't need help as fast. But if that blood clot blocks the artery the entire way across and nothing can get through, you can see it kind of at the bottom of the heart where it says damaged tissue. That's what can start to happen. The tissue can actually die. And so when enough tissue dies that the heart stops beating, that's when someone really needs the chest compressions and stuff. So we'll talk about that here in a second. Anything else? Okay. So here are a couple of warning signs for heart attacks. And so it's a little bit interesting. Men and women can, in some ways, have different signs for heart attacks, and it's just the way that their bodies work. So if you look, there's a couple of things that that can be symptoms for men. So like shortness of breath, chest pain, sometimes jaw pain. And even though we're like, what the heck, jaw pain? How can that be a heart attack? It all has to do with the way your body works and the way that your brain senses pain and senses different signals. So if you look on the other side, sometimes for women, it can be they just feel lightheaded, or they might feel weak, or they're sick to their stomachs. So it's different for everyone, but any of these signs can be something that is pretty concerning. So when we look at some of these warning signs, we also look at risk factors. So a risk factor is something like a quality a person has that increases their risk of having a disease. So some of the things that we look at are unhealthy eating habits. So if you've ever seen someone who's just eating McDonald's for a full year straight, that can be pretty unhealthy, right? And so that can cause their heart to have to work harder with all the fat and all the fatty acids coming into their body. That's what can plug up their arteries. So if someone is having unhealthy eating habits, if someone has high blood pressure, if someone has other medical problems, those can all be ways that it can be an increased risk of having a heart attack. So the good news is we can treat it. So if you call 911, it's possible that Tom or I could get to your house in 10 minutes, and we can take someone to the hospital in another 20 minutes, and we can get them right into the it's called a cardiac cath lab, and it's a kind of operating room where they can take a live x-ray of the heart and find out where the blockage is and go in and get it out with like a little tiny wire that goes in there. So it's really, really cool to see. But if we get that treatment to the patient as fast as possible, they can go back to normal and leave the hospital in a day or two. So that's perfect. So having that little blockage in there doesn't necessarily mean that they're going to die, but if we get the care to them in the right time, it's kind of like what Damien was saying, how for 3 hours he was like sitting on his leg, and then it was hard to walk because his leg fell asleep. So essentially what we're doing in the hospital is bringing that leg awake again and getting the blood flow. And so hopefully, if it's just a really short amount of time, there will be no long-lasting effects. But if someone waits a really long time to call 911, then it can be hard for the heart to recover. So that's not a good situation. Okay, so I have a short video. Let me switch to the video audio and we will watch it here.
What's the difference between a heart attack and a cardiac arrest? Heart attack. Usually, a blood vessel to the heart has become blocked by a clot. Thanks to BHF research, we know heart attacks are caused by clots in arteries. This is because the heart muscle is starved of blood and oxygen. This causes pain or a feeling of pressure or burning in the chest. Some people just feel uncomfortable, others have strong pain. The person may look sweaty or breathless. Someone having a heart attack is usually conscious. This is a medical emergency. Call 999. While you wait, sit the person down and keep them calm. Cardiac arrest. The heart has stopped pumping blood effectively. This is usually because the electrical signals in your heart have gone wrong. The brain isn't getting enough oxygen, so the person becomes unconscious. They won't be breathing normally or at all. This is a medical emergency. Call 999. The heart can't pump blood, but you can. Start CPR. Chest compressions and rescue breaths can keep someone alive until medical help arrives. Cardiac arrest equals CPR. Visit bhf.org.uk/CPR.
Okay, so that was pretty interesting, I thought. It's also kind of neat. So that video is from the United Kingdom. So there, they don't have 911, they have 999. So that's, yep, exactly. That's a good point. So 911 is here in the US, 999 is just the United Kingdom version. So you saw on there, they talk about doing CPR and giving rescue breaths. In a coming week, we're gonna learn all about CPR and the ways to do that. But for now, all that you guys need to know is that you don't necessarily need to give anyone mouth-to-mouth or rescue breaths. If you can just do the compressions, which is pumping on their chest about midway down at a rate of at least 100 per minute, that is perfect. That's enough to help get the blood flowing again and without having to do mouth to mouth. Okay, so up next, we have a stroke. And so a stroke is kind of like a heart attack of the brain. If you take a look here, you can see those are a couple of different arteries in the brain. It's the same exact idea. So we see a blood clot or something is blocking the blood flow to the brain. That makes it hard for the brain tissue to get oxygen, and it's not a good situation. So a stroke can happen from a clot in the arteries. So like everything's not coming, the correct oxygen is not coming in, or it can occur from bleeding. So those are two options. They don't really change anything that you or I will do, but just something to be aware of. So here are a couple of things that we think about on the ambulance and in public when there is a stroke. So there can be some differences between how men and women react to strokes, but a lot of times they're more similar than heart attacks, which can be a little bit different. So if we look at some of the risk factors, a lot of them are the exact same things as for heart attacks. So unhealthy eating habits, unhealthy exercise habits, high blood pressure, and some of that kind of stuff. And what are you guys supposed to do? Call 911 here in the United States and just keep everyone calm. But if you look at that graphic, those are a couple of tests that we do to help determine if someone's having a stroke. So if all of a sudden someone has a loss of balance or is unable to think about things, they're confused, that's one thing. We also look at their eyes. If all of a sudden they can't see or something is wrong with their eyes, it's unexplained. Also, if their face is looking a little bit different, it can look like they're smiling on one side and frowning on the other, or their eyes don't open equally, some of those sorts of things. If you look at their arms, maybe one arm is weak or one leg is weak. And then also if their speech is sounding a little different. So they might sound like garbly speech, or they're not able to say the right words, or not able to say any words. Those can all be signs of a stroke. And then the T of this BFAST mnemonic device is call 911 as soon as possible. The faster the patient can get to the hospital, the better chance they have of reversing the damage. Okay, up next is shock. And so shock is a natural response from your body. And the idea is that if you have ever gone running really fast or exercising, and also your heart rate is fast, you're sweating more, a lot of it is because your body needs more oxygen and it needs more supplies in order to keep up with the demand of you running faster and all that sort of stuff, the energy. So shock is kind of the same thing. Sometimes it can happen if someone is dehydrated, or if they have an injury, if they're bleeding really badly, their body says, oh boy, we need to conserve this energy. So they might doing some things to naturally do that. So their heart rate could be faster, their breathing could be faster, some of those sorts of things. So here are just a couple of symptoms of shock, and we don't necessarily go through all of them, but their skin could be pale. They might have an increased heart rate or increased respiratory rate. Their blood pressure a lot of times is low. They could be clammy skin. They could be dizzy. A lot of times it happens from major bleeding. So what should we do if we think that someone might be in shock? Well, we're always calling 911, which is really important. What we can do is we can elevate their feet a little bit, and that can help bring some of the blood back to the core of their body. We can also keep them warm, so cover them with a blanket and make sure that they don't get too cold. Those are all a couple of things that we can do. All right, now we have a couple of our actual first aid things. So we'll talk about it for a second here, then we'll go to a live view of some of our things that we can do here. So for bleeding that is not severe, so maybe someone got a cut or a scrape and the bleeding has stopped for the most part, what should we do? We should maybe get a Band-Aid or some gauze or some of the other things that you may have in your house. Make sure you always wash your hands before you help anyone and after you help someone. You can clean the wound with hydrogen peroxide as an option, or you can use some water. If someone cuts their finger or their arm, if you just have them run it under the sink with some water for 5 minutes, that is a really good way to get some of the germs out. If anyone has ever had Neosporin or bacitracin or any of those antibiotic ointments in their house, those are great things to use. And we just want to put something over it to help protect the skin and keep any germs from getting in there. So you could use a Band-Aid, you could use gauze, any of that kind of stuff. As they're healing, we want to keep an eye out for any pussiness or drainage or redness that happens, because that could be a sign of infection. Okay, we will go to our live view and we'll take a look. So we have a couple of samples of things that we use here in the ambulance, and though you may not have them at home, you could think about things that you could use in your house for this. So paper towels or Band-Aids. Sometimes people have gauze like this. So if we pretend that right here on my arm there's a huge cut, the bleeding is stopped, what Tom's going to do is he's going to fold up this gauze and put it right over the top and just apply some nice pressure. So you could use some tape, or we also on the ambulance have something called a cravat, which is a triangular bandage, and you can just put something over it and keep the bleeding controlled and keep the wound covered. If they need to go to the hospital, you can do that before they get to the hospital. Or if it's a small cut and they don't need stitches or anything like that, then you can leave that on there until it gets dirty or until you change it the next day.
So if we place this on his arm and all of a sudden it starts bleeding through, what do you think the best thing we should do? You think we should take it off and put something else on there? Or you think we should just put something else on there and just keep holding pressure?
I think that sounds like a good idea.
Yeah, so if he was bleeding through that, we can always take another one and apply pressure just like this. And now we've got all this bandage on there that can help soak up the blood. And also we can apply a little bit more pressure as well. And then we can go ahead and wrap it around to make sure everything stays nice and snug right over that cut, because we're applying that direct pressure on there.
Yeah, one of the bad things if you keep taking things off is it can make the clot really hard to form. And we want that clot to stop the bleeding.
Yeah, I always, when I explain, I always say that we're putting a scab automatically on with the dressing. So this dressing is now the scab we're placing on there. And every time you go to peek, we're ripping that scab off. So that bleeding is just going to continue. It's going to continue to ooze on out. So when you put something on there, leave it on there. And if it starts to bleed through, just keep adding more dressing to it.
Okay, cool. So let's go back to our slideshow for a moment. Up next, we have a major cut or laceration. So this is something that we want you to think about. If someone is bleeding and the bleeding is not stopping, or it's really, really severe bleeding, what we want you to think about is kind of what we talked about already, putting some pressure on, elevating the wound, and considering you could try an ice pack and see if that helps. But this is when you may need to hold pressure yourself for a little while, like maybe 10 minutes, and really just hold some really, really strong pressure on there to help stop the bleeding. You could also think about treating for shock. This is a really, really good time for you to make sure the patient stays warm until help gets there, or move them into an area that is better temperature controlled if they're outside and it's cold or something along those lines. We also have a picture of a tourniquet here. So this is a sample of what someone used, kind of like a homemade type tourniquet. We're going to go through all the tourniquet stuff in the Stop the Bleed program, which is going to be coming up tomorrow, actually. So you guys will learn everything that you could possibly need to know about tourniquets then. But for now, we just want you to know that a tourniquet is going to cut off the blood supply to the entire extremity that is bleeding. So there's been some going back and forth about if it's safe or not, and the most recent medical research says it's very safe and it can help save someone's life. The only really important thing that we want you guys to keep in mind if you put a tourniquet on someone is the time that you put it on, because that makes a big difference for us in the hospital. So we'll stop the share here for a second, and I'll show you if I have really bad bleeding up here. Tom's gonna show what putting a tourniquet on with maybe this is like a neckerchief or a cravat or something like that. So if I'm bleeding on my arm, it's gonna go above the wound and it's gonna be wrapped really, really tight. And so hopefully you can at least see a little bit here. I know the quality is not too good, but.
So I have it on there, and now scissors sitting here, just like in the picture. Now what we want to do is we want to turn this, and as I turn it, you feel like getting tighter?
Yeah, it's really tight.
So if I keep turning this, what this is going to do, like you were saying, is it stopped the blood flow down to his arm. So if he had a laceration here, we're going to turn it and turn it and turn it until the bleeding stops. Okay, and then like you said, we're not going to take it back off. We're going to actually tie it up so that it doesn't go anywhere and it stays in place until we get to the hospital. Does that make sense?
Yeah, perfect. So again, you guys will learn all about it. We just want to give you an example of what it looks like today. Yeah, Tom did a good job here, you guys.
Can't tie a knot, tie a lot.
One of the things that we think about is that sometimes when we're doing this, it's the reason that we're putting a tourniquet on is to save someone's life. So it's really important. But one negative is that sometimes it can be painful. And so even though someone's saying, oh my gosh, that hurts a lot, if they won't care if it hurts if they're dead, you know, and so it's going to be painful. You can tell the patient, you know, I'm really sorry I have to do this, but it's going to save your life. And that's what's really important. Okay, so we'll zip back into our video or our slideshow here. Okay, so we talked about lacerations and cuts. Now we have bee stings. So a bee sting can be life-threatening because if someone has an allergy to bees, it can cause them to stop breathing and they can go into an allergic reaction and allergic shock. So one of the things that people oftentimes, if they have a bee allergy, is that they will have an EpiPen with them, or they should have an EpiPen with them. And so these are the 2 steps to using an EpiPen. Take off the safety and put it into the outer part of someone's thigh. There's a lot of instructions on it as well, but it's going to be a little bit painful, but it could save their life. So some of the ways that we know that a bee sting could be life-threatening is if someone has a really hard time breathing after they've been stung by a bee, or if their lips or tongue start to swell up, or if they have really bad hives. So those are times when we might use an EpiPen. We have them on the ambulance here, or we have other ways that we can give epinephrine. But if it's maybe not a really life-threatening allergic reaction, or if someone's not allergic to bees, they've just been stung, you can consider wiping it, rinsing it with water, and putting an ice pack on there. That's one of the things that can help with the pain. Okay, so this is a little bit of a graphic picture. I'm sorry, you guys, but this is a fracture. And so a fracture is a break of any bone in the body. So fractures can happen in your arms, your legs, any bone can have a fracture. So on the right-hand side, you can see just a couple of samples of what bone breaks might look like. But, and it's not always easy to tell. Sometimes they're just little tiny breaks. Sometimes they're really, really bad breaks. Sometimes they're bleeding with the breaks too. So that's just something to think about. So has anyone broken a bone before? You can put it in the chat. I've broken my ankle before, and I had to wear a boot for like 6 weeks when I was in high school, so that was tough. But a lot of times there can be pain immediately. So if you look at this poor little kid who has their broken arm, that probably hurts a lot. So sometimes you can see a deformity, sometimes it'll just be swelling. But the idea with this is I'm gonna go back to our, oh, we have one more thing. So for example, if someone has an arm fracture, what we wanna do is immobilize the injury. So if someone's forearm is fractured, this is a sample of someone using a newspaper as a splint. So we have a couple of things that we'll show you here in a second. But step number 1 is stopping any bleeding. So we've already talked about how to do that. You guys are already pros at stopping bleeding. The next step is we want to immobilize the injury. So that means trying to prevent it from moving again. So we just need to make sure that our splint or whatever we use for a splint goes above and below the break. Also, don't try and straighten it. We'll let the doctors do that at the hospital. Okay, and then this is a sample of a splint for a leg fracture. Again, stop the bleeding if you can, immobilize the injury, and don't attempt to straighten it. So I'm gonna exit this and we'll go back to our video. So if I have a broken arm right here, there's a couple of things we can do. Thing number 1 is we have what's called a board splint, and this is something that we have on the ambulance. But you can see it's just like a big, one side is cushy, one side is hard. And so the idea is that we'll be able to put that on someone's arm just like this. And we can use some of our things that we have here, the cravats, to tie the splint on. And if my arm is broken here, the splint is above it and below it, and it's helping keep that arm still until a doctor can take some x-rays.
Usually if you have a broken bone in the middle, you want to go from joint to stabilize it. Because again, we want to make sure that it's not going to move, okay? Because obviously that's going to cause way too much pain for the people. And I know that we have this board that most of you guys probably don't have, but some of the things that you guys might have is this is just shopping bags, okay? You can fold these and make them pretty stiff. Magazine do the exact same thing. Put the arm inside there and kind of wrap it around and do the exact same thing by going from joint to joint.
Sometimes it can hurt when people are getting the splint put on, but just tell them, you know what, you'll feel a lot better.
Feel better.
Absolutely.
And of course, if he was in pain, I wouldn't be moving his arm this much. I'd have
Mhm.
somebody else holding it for me.
Yeah.
So, but that's basically about it. It's nice and stiff. Now it's, you know, it's not a board. It's just or it's just plastic or paper bags. And it was formed like this. And does it feel pretty snug, pretty
Yeah.
secure?
Yep.
So it's just something that's going to hold that bone in place to prevent that arm or those bones from moving inside of his arm.
Yeah, sometimes when people come into the emergency room, we see all kinds of creative stuff. So I've seen people use cardboard as a splint. I've seen people use sticks. I've seen all kinds of stuff. So just look around you and do some creative and critical thinking. And so you guys saw the picture of the leg. We would do the same exact thing. If my leg was broken, we could put the splint right on there and we'd be in good shape. Right. Okay, up next we have a neck or spine injury. So this is something that we think about when people fall or if they're in a car crash or something that's like a really high speed situation where there's a lot of energy coming around. So the most important thing for you guys to do is don't let them move their neck. So if someone falls from something that's really, really tall off of a roof or off of a ladder, we just want them to lay there, be nice and still, don't try and sit up. And what you can do, as you can see in the picture here, that young lady is just holding to either side of the patient's head to help remind them not to move their neck. So that can help prevent any other injuries, because every once in a while there could be a broken bone that could change when their neck is moving, and it can cause more damage. So it can damage the brain, it can damage the spinal cord. So kind of our priorities are keeping the patient or the victim as still as possible and keeping their neck as still as possible too. Once the ambulance gets there, we'll put on a collar. We have one right here that we can show you. And we want you to try not to move the victims as well. So if you take a look, we have right over there, you can see. So what we would do in the ambulance here is if my neck is broken and I were laying down, what would happen is Tom would come, someone would be holding my neck here, keeping it still, and this collar would come around and be placed around their neck. Oops, my head's getting in the way. It would be placed around their neck to help them keep their neck straight and to prevent them, because right now I can't turn my head and I can't move it side to side.
So it's just something that slips right around and it's going to hold them nice and still. Again, we want to mobilize the head, and we're doing that through this splint that we put on his neck.
Mm-hmm.
Going back to what he said is, as far as leaving the person there, do you think there'd be a situation where you would absolutely have to move somebody? What do you guys think? What if there was a car accident and the car is now on fire? Do you think that would be a reason to move the person? Yes, absolutely. As you guys are coming up on the text messages, that's great. And yeah, because I mean, obviously, if there's another thing if it's not a safe location, get that person to a safe location, because they may have a neck injury, but that's, you know, questionable. But obviously, if the car is on fire, they're definitely going to catch on fire if you don't move them. So a little bit of common sense comes into play.
Mm-hmm.
Sometimes when people do fall and they do injure their neck, they could also have a head injury. And with that, they might start arguing with you. Oh, just leave me alone, I'm fine. But just try to remind them, you know, ask them what happened. If they can't tell you, then just tell them to lay there and just be, you know, just try and talk to them to calm them down.
Yeah, those are all perfect things to do. All right. We're making our way through here really nicely. Up next, we have anaphylaxis or allergic reaction. So we talked about that a little bit in the bee sting area already, but some of the other things that you might see are hives. You might see swelling of the throat, lips, or mouth. Someone's having a hard time breathing. And a lot of times people will have had it in the past and they'll say, oh no, I'm having an allergic reaction. So even if it's not a bee sting, sometimes it's nuts. Sometimes there's different things that can cause people to have this really severe allergic reaction. They a lot of times will have an EpiPen with them. Sometimes it's medication, sometimes there's peanuts, you know, whatever. But giving someone an EpiPen, they may not be able to do it themselves. So if you see someone that's having an allergic reaction, you can just take a look. Maybe they have one in their bag or in their purse, and kind of take a look from there. Make sure you're always calling 911 though. Sometimes if you are with your parents or guardians, they may say, take some Benadryl. That's a medication that can help with minor allergic reactions as well. But always talk to an adult before you give any medications. All right, bruises. So that may not be as high on the medical emergency list as other things, but it's something that we want you to know about. So a bruise is perfectly natural. Sometimes it's purple or green or blue, or there's all different colors, but it can be after an injury. So I'm sure we've all had a bruise before. Sometimes it can be kind of sore for a little while and that kind of stuff, but all a bruise is it's little blood vessels that have ruptured and blood has escaped. And so now we're seeing that come through the skin. So again, it's totally normal, and your body will just reabsorb the blood and everything will go back to normal in a couple days. All that you guys need to do for first aid for a bruise is you could use an ice pack. Sometimes that's really helpful, or an ACE wrap or something like that, just to help keep some pressure and some ice on there. Those are really helpful things. Okay. Up next, we have sprains and strains. So sometimes a sprain could happen if you're walking and you step in a hole or you twist your ankle. Those are all things that can lead to having a sprain or a strain. And for our purposes, it's not really important that you know the difference, but it's just usually a joint that hurts when it's not broken. And sometimes they can be broken and sprained, but for the purposes of this presentation, it's someone who has pain in a joint after an injury. Sometimes people will fall, sometimes they'll twist their ankle while they're walking. There's all kinds of situations. But the treatment is really, really simple. So if you look, the word we want you to remember is RICE, R-I-C-E, just like the food. So the way that that helps is if you look at the picture on the top left, that person is resting their ankle by using crutches. Then they are putting ice on. That is a little ice pack. Up next is compression. So they're using a little ACE wrap or some other sort of elastic bandage. And last is elevation. So that's keeping the leg up or the ankle up or the arm up. And those are all things that can help reduce the swelling and hopefully help with the pain as well. All right, hypothermia. So right now, a lot of us are experiencing some very nice warm weather. So hypothermia may not be at the top of our mind right now, but it's something that some of us may have to deal with in the future as we start getting into the winter months. So there's different levels of hypothermia and they all come with different situations. But if someone is outside and they've been outside for a long time, they don't have the appropriate clothing on, they are shivering, sometimes they're unconscious, or if they've been in like icy water, if they've fallen through the ice, they could be experiencing hypothermia. So the treatments for that are slowly rewarming the patient. If they are wet, getting off any wet clothing and trying to keep them dry. Maybe putting on an extra coat or something like that. The one thing we don't want you to do is put them into a hot bath or a hot shower. That can be really bad for their skin and their body. We just want you to slowly rewarm them. So it can also be not too good if you put them right next to a fire, because that can cause damage to their skin as well, like a campfire or something like that. So hypothermia, we want you to think about someone who's been outside in the wintertime or is really cold, and then slowly rewarming them. And if they are maybe unconscious or if they're not making sense, or if they seem like they're really, really sick, that would be a good time to call 911. All right, up next is frostbite, another winter emergency. So those are a couple things. This picture shows you a couple different types of frostbite. It's kind of similar to the hypothermia. We want you to gently rewarm them. We don't want you to use fire. We don't want you to rub them or anything like that. But some of the other first aid things that we have done already. So you could use a splint. You could help keep them warm and have them talk to the doctor, call their doctor or call 911 if it's really severe. Ooh, burns. That's something that we're dealing with right now a lot with the summer months, with fireworks and all that sort of thing. There's a lot of different kinds of burns, but they can come from exposure to heat, like from a stove or from a campfire, exposure to sun. So I've seen some really, really serious burns from someone who's tanning or from someone who fell asleep out in the sun without putting any sunscreen on. They can come from electricity. Someone could get shocked, or they could come from chemicals if someone gets acid spilled on them or something like that. So there's a couple of different layers of burn or levels of burns. You can see them going from left to right. So a first degree burn is like a sunburn. It just is some redness on the skin that can kind of be sore. The second degree burns usually have blisters or some other things that you might see. And lastly is third degree burns that will go through the tissue and it goes a lot deeper. So those are really, really serious. So we have a couple of treatments for our burns. We want you to think about using some cool water, not cold water. some cool water under, you can run the burned area under some cool water. You can use some antibiotic ointment, that can be helpful as well. You can ask an adult for some maybe Tylenol or aspirin or something like that. That's pain medicine from an adult is a good idea sometimes. And also aloe gel can be really helpful as well. So you can see a couple more of those burn injury stages. Like maybe sunburns or first degree burns don't need 911, but if someone has a really, really severe burn, or if a burn is on their face or anywhere else, if it's a lot of their body area that's burned, that would be a time to call 911. Ooh, convulsions and seizures, nice. So seizures can be pretty scary. So that's when someone is shaking or they're having muscle spasms. Sometimes they'll black out. It can be from a medical issue. Sometimes people have epilepsy and that can cause it. There's other reasons that someone could have a convulsion or a seizure. All we need you to do is try to protect the patient from hurting themselves. Don't panic, that's really important. And if the seizure lasts for more than 5 minutes, you could think about calling 911. Or if they have never had a seizure before, or if you just don't know what to do, we'd love it if you call 911. And if it turns out that the ambulance isn't needed when we get there, we'll be happy to head back. But we would much rather have you call us and we're not really needed than for you to call us late and realize, oh, I wish I'd called the ambulance 10 minutes ago. So you can put someone on their side. Sometimes they'll feel sick to their stomach and things like that. So again, for convulsions or seizures, you can protect the patient from hurting themselves. Sometimes patients have medications that you could talk to an adult about and kind of help them rest on their side. Dehydration is another thing that we're dealing with a lot now. It's the summer months, it's really sunny out. So it can happen when someone isn't drinking enough. They can sometimes even be so dehydrated that they stop sweating. So they could be weak, they could be dizzy. Some of those are other signs that you can see on that little graphic. So what we want to do is help replenish their water. You could give them some water to drink or some Gatorade with some electrolytes. The one thing we don't want to do is have them drink an entire huge jug of water because that can be bad. We want to slowly replenish their water and electrolytes. Okay, muscle cramps. That may also not be a 911 emergency, but it's something that people deal with pretty regularly. So it's a sudden contraction of the muscles and can be pretty painful. Sometimes it's like when you're exercising, or they could just come out of the blue. A couple of ways that you can help prevent and treat leg cramps are replenishing water, maybe drinking some Gatorade that has some electrolytes. You could try an ice pack and see if that helps, or massage the cramped muscle. Stretching is really helpful as well. Okay, heat exhaustion and heat stroke. That's another thing that we're dealing with a lot right now because of all the summer and warm weather. So you can see there's a little bit of a difference between heat stroke and heat exhaustion. Essentially, heat stroke is just more severe than heat exhaustion. So there's a couple of ways that we in the healthcare community differentiate them, but they don't really impact the things that you do necessarily. The treatments are still going to be the same. We want to make sure that they're getting enough water. We want to make sure that they're replenishing their electrolytes. So maybe some Gatorade or Powerade or something like that. And then removing them from whatever is causing it. So if they're outside in the sun, get them in by a nice shady area or in the air conditioning. Allow them to just take some nice deep breaths and help keep them calm. If a patient starts to not breathe normally, or if they're not responding to you normally, that would be a time to call 911. Sometimes you can tell that someone's having heat exhaustion or heat stroke if they're sweating, if they're clammy skin, if they're sick to their stomach, their heart rate is fast. Sometimes heat stroke will even get so bad that they stop sweating. So just keep an eye on that. Be very careful during the summer months to make sure you have enough water and making sure you're staying in the shade and using your sunscreen. All right, up next is abdominal pain. So that's something that we've all dealt with from time to time, I'm sure. So you might be sick to your stomach. There might be some vomiting or some nausea, which is feeling like you're going to vomit. So that along with the stomach ache and all that sort of thing. The treatments for that, sometimes, at least from my experience, maybe we don't need to see a doctor for every time we have a stomach ache, but if you just take it easy, get some rest. A lot of times when I have a stomach ache, having some saltine crackers or something really simple is helpful, and maybe some Sprite. If there's other medications that you take from an adult, that's an okay thing as well. Just make sure you're getting any medications from an adult. Sometimes like a warm pillow or something like that on your stomach can be helpful as well. A nosebleed. Here's another one that we deal with. Sometimes it can happen just out of the blue. If the air is really dry, it can cause like some cracked blood vessels in your nose. Sometimes it can happen if you hit your head, or if you get like, I've seen footballs and baseballs to the nose, that can cause it. So the first important thing to do is make sure you're applying pressure to the nose. It's kind of like how Tom talked about. If you pull up the scab, it'll start bleeding again. So they just want you to hold pressure on the nose for 10 minutes. So you can see in this little graphic, what we want them to do is have the person sit down and relax, have them kind of lean forward, because if they lay back or lay down, it can cause the blood to come in and can make it hard for them to breathe. You can use some ice packs. Those can be really helpful, and just apply that constant pressure for about 10 minutes. See if it helps, and if it doesn't help, do another 10 minutes. Ooh, tooth problems. All right, so tooth problems can happen if someone is maybe kicked or is hit, or maybe a football or baseball to the mouth. Sometimes if people fall. If it's an adult tooth, that's something that we would want people to save if it falls out. So one of the ways that you can save it is you can put it in a glass of milk. Isn't that crazy? But the milk will help keep the tooth moist, and it'll keep it safe, so that way a dentist could possibly reimplant it. If it's a baby tooth, they probably would not reimplant that sort of thing, but there can be bleeding as well. So if you apply some gentle pressure to where the tooth was, you can use an ice pack to help with that sort of thing. And be careful not to cut yourself if there's sharp edges around the chipped tooth area. Moving an injured patient. So this is something that Tom talked about a little bit earlier. If there's a really dangerous situation, that might be a time to move a patient. In general, we like to try and leave patients where they are until rescuers get there. But if you are, whatever you're trying to do, you're not able to do it there, maybe if someone is below a tree and it doesn't look like a safe situation for them, then you may need to move the patient. So there's a couple of options we have on the screen of ways that you can move patients. Try and have someone help you. You could use a blanket or something along those lines to assist you, but just be very careful, especially if they've fallen or if they have a concern for a neck or a head injury. Okay, coming up, this is one of your pieces of homework for tonight. So you guys are going to take a look. There's links included in today's emails, and it's on our website as well, the Family Emergency Plan. So this family emergency plan, Amy talked about it a little bit during her FEMA conversation, but essentially it's a plan that you guys can sit down with your family and talk about. It has information on there about your names, your ages, your date of birth. It can have information about if there's a fire, where should we meet? Should we meet out at the bird bath in the backyard, or should we meet out at the mailbox by the street? But one really important thing is everyone should know what the plan is before something bad happens, because that's the worst time to try and think of what you're supposed to do. It can also help if maybe you guys are home alone and Tom and I come to your house for an emergency. They can have very important medical information on there that we can get based on this family emergency plan to help us take care of you. So the links are all included in today's information. That's it for our presentation. We'll stop sharing now. Does anyone have questions about any of the stuff that we talked about or any of the information? Anyone want to know anything about first aid before we end for the day? Okay, awesome. I'm just going to check my phone and make sure I've not forgotten to include anything in today's topics. It looks like...
Thanks, John and Tom, for doing this. Appreciate it. You guys did a great job.
Yeah. Okay. It looks like things that we want you to be thinking about as we're going through today. So we talked a lot about first aid and the ways that you guys can help people, the ways that you can provide first aid until maybe a rescuer gets there. One of the other things that we are talking about is the Family Emergency Action Plan. So you guys can take a look at that. It doesn't take too long to fill out. You can sit down with your parents and kind of go through it. It goes right on the fridge. That's where we typically look, or somewhere around the fridge. So if you can put it up there on a magnet, that is so perfect. Or some other place that's really easy to access. We do have a couple other links. There's a lesson plan for making your own first aid kit. You guys are welcome to do that. If you do, take a picture and send it to MJRI, and we'll give you some bonus points. There's also a coloring contest page. So if you download that, you're welcome to submit your design, and the best coloring contest winner will get a gift card. And Damien is asking, is that a defibrillator? It sure is. We can take just a second if you guys want and talk about the ambulance. Tom can give you a virtual tour here.
Oh, you bet. Yeah, so like you, obviously this is where our patient would be, is right here on the cot. I don't know if you can see that or not. Yeah. So we have our stuff on here now, but this ambulance is designed to have one patient right here, and we can have up to three people back here. There's 3 different seats back here for the emergency technician to take care of them. The seat that I'm in, the seat that John's in, or we also have the chair up there. The chair that's at the head of the bed is usually called the airway chair, and that's just to help with making sure that the patient has a good airway. Like Damien had said, that is our defibrillator and our heart monitor, and we're able to do some of the vitals, like checking blood pressures, their pulse ox, and all that good stuff can be hooked up right to the patient. So it's constantly monitoring the patient when they get here. We have oxygen ports throughout the ambulance. This is our COVID sheet. If we come in contact with a patient that has COVID, we have to drop this down to protect us and them. But aside from that, we have oxygen port here. We have 2 of them over there. A couple of them over here as well. We have our radios. Obviously, if we are transporting the patient to the hospital, what we can do is we can give the hospital a call, let them know what kind of patient we're bringing in, whether it's an injured person or a sick person. Just like 911, they give us a heads up on what we're going to deal with when we get to the person's home. We want to give the hospital a heads up as to what they're going to be dealing with when we bring the patient to the hospital. So this is very important. Also, if the patient is really sick, we can call for med flight or call for a helicopter. We can get advanced life support, paramedics, and things like that on scene as well. And then, of course, just down from that, this is how we control the ambulance. Has all the lighting and everything is controlled. It's called a VLUX, and it basically tells us how the ambulance is doing. So that's how we control the lights and everything. And then, of course, we have our IV kits, our start kits down over there. So if we have a patient, like John was saying, that was dehydrated, we can give them some fluids, and we can start an IV on them. So we can do all sorts of stuff here in the back of the ambulance.
Okay. Well, thanks you guys very much. It was great to talk to you. And we will be back tomorrow with our Stop the Bleed stuff. So until then, think about some of the first aid things that we talked about today. What we'd really love is if you would share this information with your family and talk about ways that they can be involved in first aid as well. That's awesome. Fill out the family lesson plan, the family emergency plan, and we will see you tomorrow. Take care, guys.
See you guys.